Today we're in the city in a bookstore. I'm going to sit down with Dr. Ritu. Hi, so good to see you.
You as well.
She's a clinical psychologist, and we're going to talk about the emotional and psychological effects of cancer treatments. So you get a cancer diagnosis, and the first thing I think of is the emotional effects of that.
Getting a cancer diagnosis can be frightening, right? The C word it's a very scary word. And I tell patients that early on, you're going to have a whole host of different emotions: anxiety, distress, anger, frustration, guilt. Just because we have emotions that are difficult doesn't mean that we want to get rid of them. We want to understand them. What I suggest to them is that they journal. Take time just to write down what you're experiencing.
So when is the right time for someone to find someone like you to work with?
The ideal time is really oftentimes dictated by the individual. Some folks really like to have support from the beginning. Other folks find that they do well and don't really need to work with anybody.
How do you know when it's a common emotional response versus something serious that they should call the doctor about?
Oftentimes, if people are feeling down and depressed and it's been several weeks at a time, they're isolating, they're thinking about abandoning their treatment, these are all indications that potentially this person really needs some support and help. Oftentimes, there are a lot of biochemical changes that are happening in the body that also impact one's emotional state.
What I didn't know is that you can actually receive a lot of emotional side effects from the actual medication, not just from the emotions of having a cancer diagnosis. Are there actual steps that you give patients?
Patients really want to continue feeling productive in some way. And so one of the most important things one can do is to continue to do the things that make them feel whole. Let the people in your life know what you want to continue to try to do for yourself and for others, and what are the areas that you need help with. So instilling some hope is important for the individual. And when we can do that, we find that they're more likely to be able to manage and tolerate side effects better. They're more active and more engaged. And when they are able to do that, not only do they recover in a healthier way, but they have a higher quality of life.